Well, the rationale is that indeed life is not easier with the introduction of primary systemic therapy. In the past, we used to base our radiation therapy prescriptions, the target volumes, the dose, etc., only on the initial tumor stage. Now, more and more in high-risk patients, we give first chemotherapy. But this often leads to a remarkable response of the tumor. So we have often tumors which are in a complete response after surgery, based on surgery. So the tumors responded very well, and then still only base the radiation therapy prescription on the initial tumor stage is missing an opportunity to fine-tune. So it depends, of course, on a number of characteristics: the initial tumor stage, the type of systemic therapy given, the response, and also the biology, which we should absolutely not forget. There are tumor types which have much more favorable benefits from the chemotherapy or the endocrine therapy, and others are much less sensitive to a favorable response. So it depends. For example, if you take a triple negative tumor, it has a likelihood of 50% of having a good response. Afterwards, we might tailor our radiation therapy volumes as well as the radiation therapy boost doses. So for example, the volumes include the lymph nodes. If initially we don't have a clue about the tumor, about the nodal stage, but afterwards, after the chemotherapy, the nodes are negative on examination, for example, sentinel lymph node biopsy, why should we still irradiate the nodes? The same with the primary tumor. If after primary chemotherapy there is no residual tumor found on lumpectomy, on pathological examination, why should we increase the boost to the breast by giving a boost dose to the primary tumor bed? Now, triple negative is the risky one. We cannot de-escalate further than that. If we look into the HER2 positive, they're even more sensitive to the treatments, and the targeted treatments they receive are even more effective. So there we might even look beyond. We could even go to further diminishing both the volume of the radiation therapy as the dose of radiation therapy, which is currently ongoing research, because we need to follow what we learn from yesterday to build a better future for tomorrow.